My name is Mike Wright. I'm the head of the Health, Safety, and Environment Department for the United Steelworkers.
And what are the issues you face in your industries as far as the protection of workers, health and safety in the communities?
Well, I think the best recent example is, although we're called the Steelworkers, we represent a majority of the organized workers in oil refineries, and we have a little over 2/3 of the refining capacity. We just went through a lengthy labor dispute with about 16 of our plants out on strike with the industry, and it was largely over safety and health. It was over what we call safe staffing, which is first getting away from a system where people are working 80 and more hours a week. We have people in refineries who are forced to work sometimes 12 hours a day for 30 plus days in a row, and we needed to do something about that. The companies initially refused to even talk to us about that, which is an unfair labor practice. So we engaged in an unfair labor practice strike over that. So and we were successful in gaining some new language. We will work very hard to implement it, and we'll see where it goes. Fatigue is a major problem. It threatens not only the safety of workers in the industry, but it threatens the safety of communities in which these plants exist. So we're pushing back very hard on that. We're trying to make that work. We have the new language, but now we've got to implement it, and we're going to be working hard to do that.
And I mean, there is a fear among workers, union and unorganized, that if they speak up about health and safety, they're going to be terminated, retaliated against. Is that a concern for the union as far as workers speaking out about health and safety in the oil industry? We have tried very hard to make all of our members know that if they speak out about health and safety and their employer retaliates, we will back them up. We will use every resource at the union's disposal to fight those cases out, and we rarely lose those cases. We have a grievance and arbitration procedure. We've got the OSHA 11C language, but we also have just push it. There's so many ways that we can push a company hard to get discipline removed, to get people back to work, and if one of our members gets punished by a company for doing what he or she believes is the right thing, we will fight those cases aggressively. Now, there's been an epidemic of refinery explosions around the United States and the Gulf. I mean, it seems like they're continuing, and the industry really hasn't said we're going to make a stop or we're going to have stronger rules. They've been fighting rules in Congress, fighting legislation to strengthen health and safety protection. Why is it that there are all these oil refineries and explosions in the United States, and why is it that no executives have gone to jail for keeping plants running when they do explode?
We've really started tracking fires, explosions, and toxic releases in refineries in the U.S., and we figure there's about one a week. A lot of those don't injure anyone, but they all have the potential to do that. A lot of those don't spread to the surrounding community, but many of them do. There are hazards in refineries that could affect, and this is not my number, this is EPA's number, that in a major catastrophic release could affect 1 million people. 1 million people. Again, that's not my speculation, that's EPA's hard estimate. So the oil industry is very powerful. They have a lot of friends in Congress, but we've also got a strong union. So we're really pushing very hard to try to reduce that. We've strengthened our safety committees. As I said, we just had a strike that was largely over safety issues. We're doing everything we can.
Last question. I mean, these are highly toxic materials. They're released to the workers and to the communities. What is happening with cancer clusters and the issue of cancers from oil workers and others who work in the industry? Are they getting compensated? I mean, it seems like it would be a big problem.
We've been there's a cancer problem in many American industries. We've focused in the last couple of years more on the catastrophic potential. As long as everything stays in the piping and stays in the reactor vessels, a refinery is reasonably safe. The problem has been when there's a release, and some of those releases can be relatively small and can affect and can cause cancer 30 years down the line. Some of them can be large and can cause death and destruction right then, and all those things need to be worked on. So we've looked at, we spent a lot of time looking at those catastrophic incidents, but we're beginning to really look at cancer rates as well, and to see what kinds of things we can do to try to reduce that toll.
Does the union do a study or statistics of workers who died as a result of cancer who work in the refinery industry?
There have been some studies. We have not. One of the problems with us doing that kind of a study is it's very hard to get a hold of the data. Some unions run their own pension plans for their workers. We don't. So we don't have good data on what happens to people when they leave the industry. We have to depend on NIOSH or on university epidemiological programs for that. But the studies that have been done show that there are problems in many American industries, and we know there are things used that are created or used in refineries and again in many other industries that can cause cancer. To us, that's enough. I mean, you don't need to prove that people have gotten cancer 30 years later to know that we've got to control a carcinogen. We know that right away. We know we've got to contain it. We know we've got to replace it with something safer if we can. We know it's a hazard, and you don't need bodies on the ground to address it.